All right, hi everyone. This is Mrs. K, just here recording the first lecture for you. So you know, since this is the first lecture, you'll be able to follow along with my audio while following along in the PowerPoint. However, in Canvas, you will also have access to the PowerPoint directly. So if you want to print it off, make notes on it, whatever you choose to do. But I'm here to kind of give you a little more info than is in the lecture PowerPoint itself. All right, so first chapter here is everything that's kind of going to go into before we put our hands on someone or treat someone. So before giving care, chapter 1 in your American Red Cross book. So some things that you're going to understand from this chapter is how to prepare for an emergency. It is really important to be able to prepare for the unexpected. Also, you're going to understand your roles as they serve in the emergency medical service system, how to lower the risk of contracting an infection or sharing an infection, how to take action during an emergency, which includes the emergency action steps, and then a skill that we're actually going to do in class is how to properly dispose of your gloves. All right, so preparing for an emergency. Emergencies are defined as an unexpected situation that require immediate attention. Emergencies are going to be things that are all across the board, whether it be someone who is in cardiac arrest or a fire or a car accident, but they encompass a lot of different things. The better that we're able to prepare for these unexpected events, we're going to increase the likelihood of a positive outcome from that emergency versus if you are not prepared at all, it's going to take you a lot longer to care for that situation or know what to do. So how are some ways we can do this? First off, reading and understanding the manual to this class and participating, as well as, of course, passing and receiving your certification. Reviewing the skills and concepts often. What's going to happen is you're going to learn all these skills, and if you don't review them in a year from now, you might forget what CPR is. So making sure that you're reviewing them often because they aren't going to be skills that you are going to use on a day-to-day basis. How to access emergency equipment, so things like a first aid kit or an AED, knowing where they are, wherever you are, is really important. Some cases you may not have access to these items and you might need to develop a plan to get them. So maybe one day in your job there isn't a first aid kit. Well, maybe you take it upon yourself to create a first aid kit for your workplace. Being familiar with your workplace emergency action plan, we'll talk about these a little more. And keeping current list of emergency numbers. You don't always just call 911. Sometimes there's a different number that is designated as the preferred number to call to get help as quick as possible. So first aid kits. First aid kits come in all shapes and sizes. They have a lot of different things in them. Some are very simple, some are very complex. They can be purchased from stores already pre-assembled, or you could assemble one yourself. It's really important to check the first aid kit often to make sure that items have not expired, or maybe you use something. The worst thing that can happen is you need gauze and you go to the first aid kit and the last person that was in there used all the gauze. So making sure that items are properly stocked. So what do you think should go in a first aid kit? So think to yourself, if you were to have to assemble a first aid kit, what would you put in it? The American Red Cross text is great at providing you with a lot of different tables and boxes and diagrams. So in box 1-1 on page 3 of the course manual, you'll see a complete list of what the American Red Cross recommends. So commonly people think of gloves, exam gloves, latex-free gloves, different types of Band-Aids, making sure you have multiple sizes and shapes of those. Gauze is a really important thing to have in there. You might have some roller bandages, some triangular bandages, maybe some form of splint, some type of wound cleaner, or an antibiotic ointment. So that's just a few things that, can go into the first aid kit. So emergency action plans, some of you may have heard of these before, some of you may have not. Emergency action plans, or EAPs as we call them in short, is a manual that is developed to prepare for emergencies. Basically, it's going to be a document that's going to provide instructions as to how you handle an emergency event. The whole point of this is to ease confusion, decrease the amount of time it takes, so that you're responding to emergency as quick as possible. You have to remember, in life-threatening emergencies, every second counts. It can mean the difference between someone surviving or not surviving, or having permanent deficits or not having permanent deficits. So emergency action plans are really developed to speed in the response time. A lot of things that go into emergency action plans are things like the roles and responsibilities of people that are there, okay? So who's in charge? The highest trained person is always going to be the person in charge of a situation. However, you might have people that fall under that. So what are their roles? The emergency numbers are listed there, 911, or maybe the local police department number or the local fire department number. In some areas, sometimes it's better to call the direct line. In rural areas, you might not get pinged from a cell phone tower to the closest department to you. Also, other numbers you might want to consider in some cases are the campus safety and security number and the poison control number. Next would be your emergency equipment, so the first aid kits like we just mentioned, as well as AEDs. We'll talk about AEDs when we get into cardiac emergencies more in depth. Evacuation plans and maps, so how are you going to get out of the building in the event of an emergency, as well as how does EMS access you in an emergency. If you think back or look at your workplace, have you ever seen an EAP before? Have you ever been asked to read one so that you are aware of what you need to do? I'll give you a hint. In MCLA alone, there is one in every classroom that I've ever been in. So I encourage you to take a look and try to locate that emergency action plan. So your role. The whole point of this class is to certify you as a first responder in American Red Cross's standards of first aid CPR for adult, child, and infant. So you are going to serve a role in what we call the Emergency Medical Services System, or the EMS system. Don't always just think of EMS and think of, your EMT that's arriving to the scene in the ambulance. There are multiple people that play a role in that emergency medical system. It is a network of a variety of professionals, and all of those professionals are linked together in some way to respond to emergencies. You actually play a really important role, because in most times the system doesn't start until you make that first call. So can you think of anyone else that might be part of the system? Take a minute and think about who else might be involved in the EMS system. So hopefully you're thinking of EMTs. We also have paramedics, police officers, firefighters. They can all be people that are considered to be part of the EMS system. So your role is defined by 4 basic steps, and it's really important that you understand all 4 basic steps and you incorporate these into your thought process when caring for an emergency. Like I said, these are important to know, and it is important to know them in order. So the first step is recognizing that an emergency exists. Second step is deciding to act. Third is activating the EMS system. And fourth is giving care until a higher trained person comes along or EMS comes along. The next following slides, we're going to go into more depth on these 4 roles. So the first role, recognizing that the emergency exists. You have to first identify that there is an emergency. If you don't identify that there is an emergency, then the next steps can't happen, and that person can't receive the care that they need to receive. You need to be able to use your senses, okay? So use your sight, use your sound, use your smell to try to figure out whether what's going on, and is it an emergency. So think about, what would be defined as how you would identify that it's an emergency. I've put up there a few pictures, car accident, okay, sight right there. You can see the accident. Also, can you do anything else? Could you potentially hear the accident occur? You may smell fire, you may smell gasoline. Those would be all indicators. I always tell people too, don't forget about what I joke as your sixth sense, so your gut instinct. If you feel that something is an emergency, you need to consider it an emergency. All emergencies aren't going to be really clear, cut, and dry like the car accident situation. Sometimes it's going to be difficult to identify them. The next step is actually taking action. So if we think about it, we have we'll just use the example of the car accident. We have now seen that an accident happened, okay? So now we have to decide to take action, okay? Once you take action, it's not always simple as just going over and helping someone, okay? Some of us panic. Sometimes we don't want to be the person in charge. Sometimes we just assume someone else is going to help for the situation, okay? Your decision to take action can make the difference of life and death, though. And I hope after the next 8 weeks, you feel a lot more comfortable with actually putting yourself in those emergency situations and helping. Your decision to act will be guided by your values, your knowledge. At minimum, if you decide not to care, you should always call 911 or the designated emergency number. Like I said, a lot of us have a lot of fears and can result in hesitation in the response of an emergency. Oftentimes, understanding these concerns can help you overcome them better. So common fears that people have, and I encourage you to kind of think along as we're going through these, but being uncertain that there actually is an emergency, okay? You might not be so sure. Also assuming that the situation is already under control. Everyone likes to assume someone else is going to do it. So you decide to just walk by, or you decide to just kind of ignore that there's even anything going on. Fear of catching a disease, okay? If you actually put yourself into the situation, you may be coming in contact with people's blood or other things, so you might be afraid that you're going to catch a disease. Also, people can be squeamish to things. Who's afraid of blood, or who at the sight of blood just kind of makes them feel like sick to their stomach, okay? Hopefully we can get past that fear a little bit, because we're going to be talking about a lot of things involving caring for people who might be bleeding or vomiting or other things like that. And the last one, of course, is the fear of being sued. We live in a time that, everyone wants to sue for anything. The Good Samaritan law is a law that was created to protect those who have provided care without receiving any reward. So pretty much what it says is, if you're walking down the street and someone's in a car accident and you go over to help them, and maybe the outcome isn't what those people wanted, they decide to sue you, you will be covered under the Good Samaritan law, so long as you provide care as any other reasonably prudent person would do in that situation. Okay, so long as you don't go out of your certification level or do something so absurd that no one else would do in a situation. So sometimes I give the example, it's really extreme, but you got someone who's in cardiac arrest and you decide that you saw on Grey's Anatomy the other night how to do a sternotomy and crack open the person's chest and start doing stuff to massaging their heart. Okay, that is not within the scope of practice. You will not be taught how to do that. Okay, so long as you don't do anything out of the ordinary in terms of care, you will be covered under the Good Samaritan law. And I encourage you in box 1-4 in the manual to read more about Good Samaritan laws. Good Samaritan laws do change state by state, so it's important to understand what the state says. But overall, they basically all say the same thing. So like I said, think about it a little bit. What are your fears? If an emergency happened, what might create some hesitation in your thought of caring? Third step is activating the EMS system, okay? So during a life-threatening emergency, it's really important to activate the EMS system because the sooner more advanced help arrives, the greater chance the person is going to have at a positive outcome. Okay, we are going to learn some skills in this class. You're going to learn how to perform CPR. You're going to learn how to perform, maneuvers to help someone who's choking. But ultimately, the care that you're taught in this class might not be enough that person needs. So it's important to get those more advanced rescuers there on scene to transfer the person to get further help. You might be unsure if you need to activate. I always tell people to use your best judgment from all the information you're going to gather from the incident. Also from this class, you're going to learn about a lot of conditions that are conditions that you're going to need to call for. So you were going to learn that as we go. Also in box 1-5 of your course manual, it will list a whole lot of reasons as to why you should call. For example, a few of them are someone who is not responsive or what we call unconscious. Also, if you have someone who's not breathing at all or their breathing is very difficult and very painful. Someone who's had a seizure is another example. Someone with obvious broken bones. Okay, someone who's vomiting blood. Those are all reasons to call. I would say when in doubt, it's better to make the call. In most cases, you'll call 911. However, in some areas, like I mentioned before, you might be calling a designated number. The EAP will denote the different numbers and the best way to call. However, if you're at the movies, and a person in front of you appears to be suffering from a heart attack, you're not going to waste the time to run to the movie theater personnel and ask them, where their EAP is and what their EAP says. You're going to go ahead and take your cell phone out and call 911. However, if you are, say your workplace one day, so maybe you become a teacher one day in your school, you would want to know the best number to call. In some areas too now, you can actually text 911 and get a response. Remember that also anytime 911 is called, they will activate someone to dispatch to the area. And then 4, so giving care until help arrives. Pretty much in this class, after the first couple lectures, you're really going to learn a whole variety of ways to care for a variety of different emergencies. Giving care can be the difference between life and death, like I said before, or complete recovery of a permanent disability. Just activating EMS may not be all that person needs. In general, there's a few rules. You're going to provide care to an ill or injured person until another trained rescuer arrives and takes over. That doesn't always need to be the EMT. There could be a doctor in the building that you're at, and he comes over and he takes over. Next is you become too exhausted to continue. Now, a lot of you might kind of look at that and say, really? Like, I can stop if I'm too tired. Well, you'll learn when we start actually practicing CPR. CPR can be really taxing on one's body depending on their physical activity condition. So yes, if you are too exhausted, you can cease care. And if the scene becomes unsafe, hey, it's never okay to put yourself in danger. There's no need to make yourself become an ill or injured person as well. So if the scene is unsafe, then you should not be providing care. Next topic to dive into, and you might feel like this is a lot of kind of random tidbits, but it's all the stuff you need to understand before you learn how to care for someone. So you must obtain consent or permission from a person who is conscious before you can provide care. So you need to be getting permission from an adult, or in the cases of a minor, their legal parent or guardian. To obtain consent, you should always state your name, state the type and level of training you have. For example, you can mention that you are first aid and CPR certified so long as you pass this class. Explain what you think is wrong, explain what you plan to do, and then ultimately ask if you can help. Okay, you might be thinking like, oh my gosh, I got to think of all these things, but it comes out pretty fluidly, especially after you practice it a few times. So for example, I would say, hi, my name's Sarah. I am a certified athletic trainer, so in my case, that's my highest level of certification. It appears as though you're choking. I can help you in this situation by providing back blows or abdominal thrusts to try to get the object out, and ultimately, can I help you? With this info, a conscious infant should be able to give you what we call expressed consent. They can either verbally give you a yes or no. Also, they could shake their head yes or no if they're unable to speak. Also, in some situations, you might be dealing with a language barrier. So that person may shake their head yes or no as well. If a victim is what we refer to as unconscious, or confused or mentally impaired, they may be unable to understand what you're asking and grant consent. In these cases, the law assumes that the person would give consent if they could do so. We refer to this as implied consent. So pretty much you would assume, if you had someone who was unconscious, you would assume that if they could, they would say yes, they want your help, and you go ahead and provide help. Implied consent also applies when a minor is in need in the event of a life-threatening emergency. What should you do if a conscious victim or parent or guardian refuses care? Yes, unfortunately, you have to obey by their wishes, even if you know that they need your help. What you can do is explain to the person a little more why you feel like they could use your help. If you're a complete stranger, not everyone's going to be comfortable with you just coming up and helping them. Never ever touch the person or give any type of care if they are verbally telling you no. Okay? You can be sued for doing that, so you need to make sure that you don't touch someone if they are telling you no. If you believe the situation is a life-threatening emergency from what you can tell, it is okay to call 911. The best thing to do is to call 911, stay in the area around the person, because they may change their mind. Also, once 911 gets there, they can decide what they want to do. They might decide to refuse 911 as well. Okay, they might refuse the EMTs. Or they just might be more comfortable with those professionals taking care of them. Also, initially a victim could give you consent and however, withdraw their consent during your care. So make sure that you immediately stop what you're doing and always abide from their wishes. So why do you think, besides the few things that I've mentioned, that someone might refuse you helping them? Okay, and then what do we do in the event of a language barrier? Okay, this can happen, and how are you going to handle your care? So I always tell people, if there's a language barrier, one of the best things you can do is use visual cues. So if you think someone's choking, pointing to your mouth, to try to indicate that you know what's going on. In some cases, if you can, draw a picture. So trying to communicate with them with signs to try to create some type of bridge between the languages. Next, we're going to talk about lowering your risk for infection. Okay, so when you're actually providing care, there is a chance you might come in contact with some diseases. So how do we lower the risk of coming in contact with these diseases? Can you think of any examples of types of bodily fluids you might come into contact with? People don't really like to think of these, but what might you come in contact with? First two that come to mind for me are blood and vomit. Those are two of the most common bodily fluids that you might come in contact with. These fluids could contain what we call our pathogens. Pathogens are harmful microorganisms that can contain diseases. These pathogens can be spread from one person to another via a direct or indirect contact transmission. Direct contact is when the pathogen is transported from one person to another through physical contact, versus indirect is when the pathogen is transported from one person to another by touching a contaminated object. So can you think of an example for each of these? So a great example of direct transmission is someone's bleeding and you go to help them. You have a cut on your hand, you don't cover and protect your hand, and you come in direct contact with that blood. Indirect transmission, I got the great picture of the person sneezing and not covering their mouth. It's pretty incredible how far a sneeze will actually go if you don't cover your nose and mouth. It's kind of gross. But someone sneezes and that lands on a desk. And then you touch the desk with your hands and then you wipe your face. Okay, I will make you all germaphobes by the end of this 8 weeks. So pathogens, okay, pathogens you can come in contact with may pose some real serious health risks if you don't protect yourself. A few pathogens to mention are bloodborne pathogens. Bloodborne pathogens are spread from blood from an infected person enters the bloodstream of the uninfected person. These pathogens can include things like HIV, the hepatitis B, C, and D. The good thing is they're not easily transmitted. It takes a lot of the pathogen to actually contaminate someone. So that is a plus. But what are some examples of how these diseases could be transmitted during an emergency? Next is airborne pathogens. So these are spread when an infected person expels them into the air. Okay, so the previous picture of our nice, fun sneezing person back here. Okay, So that person sneezes, those infected droplets land on something, and the unaffected person inhales them or comes in contact with contaminated objects. Some examples of pathogens that are transmitted this way are influenza or the flu, as well as tuberculosis. In box 1-6 in your course manual, it discusses a few more diseases in detail. So more specifically, it goes into more detail on tuberculosis, hepatitis, and HIV. So important is, how do you protect yourself? Because you don't want to not decide to act because of fear of being contaminated with something. So how do we protect ourselves from performing the skills that you're going to learn? It's really important to minimize exposure by protecting yourself, but also keep in mind you're also protecting the victim. You may have a harmful pathogen in your body that you want to make sure that you don't transfer to the victim themselves. So what we're going to need to do is use personal protective equipment, or PPEs, as well as making sure that we're washing our hands really thoroughly after providing care. Personal protective equipment is used to prevent pathogens from contaminating us. Can anyone think of examples of PPEs? I give you a big hint here on the slide, the gloves down in the corner that you can see picture-wise. That is probably one of the most common personal protective equipment that people think of. PPE should be readily available, that you can get to them very quickly in the event of an emergency. Where do you think are some places that you should keep these personal protective equipment? I think of my car. Okay, in my car I have gloves, I have gauze, I have a CPR breathing barrier, which we're going to talk about. Okay, I keep those things in my car because why? Car accidents, right? Okay, I could be driving down the road and witness a car accident. I'm not the type of person that's just going to keep driving by. I'm going to stop and I'm going to help in that situation. So I keep them in my car. I keep them in my house. I have them at work. So the two most common that people are going to think about are disposable gloves and CPR breathing barriers. And those are the two we're going to use in this class most commonly. Disposable gloves are meant to be thrown away once used. Okay, in this class I might have you reuse yours because, well, you're not coming in actual contact with something, just to save a pair of gloves. But when possible, you should always use non-latex. Okay, you might not have an allergy to latex, however, the person you're caring for might. Also, when wearing gloves, you should limit the contact with other surfaces and other victims. Okay. For example, you're wearing a pair of gloves and you just took care of a situation and you go and you touch the doorknob. Okay, so whatever pathogens that you may have come in contact with are now on the doorknob. So you should always remove those gloves. Also, if you are caring for one person, you move on to the next person, you should remove those gloves and put a new pair of gloves on. You should always wear gloves. We'll just say that. Whenever you're caring for someone, just put gloves on. But more importantly, always wear them when you're dealing with a situation where there's blood and other bodily fluids. Also, if you have a break in your own skin, so for example, you have a cut on your finger, you should always put a bandage over that cut, so maybe a Band-Aid, before you put the gloves over. The gloves could break. And once the gloves break, then your cut, if that wasn't covered, has now become quickly exposed to that pathogen. When you're done providing care, you should always remove and dispose of your gloves properly. So in class, we're going to practice this, but it's skill sheet 1-1. The next PPE is CPR breathing barriers. So these are barriers that we use when we have to provide a rescue breath. They go over the person that we're caring for's face, and we breathe into a breathing device in these barriers. There's a lot of different breathing barriers. They all come in different sizes. In the bottom corner, you can see a big fancy one. It's going to go over the mouth and nose. In this class, it's a really kind of simple one that you can keep in that keychain that you can access quickly. Next is hand washing, and I always joke every year, but yes, we have to talk about washing our hands, okay? There are a lot of people that don't wash their hands long enough. You should always wash your hands thoroughly after giving care, whether or not you've come in contact with anything. And I always tell people, wash, not just your hands, but wash up into your arms a little bit. Things can splatter and come in contact with your skin. You should wash your hands for a minimum amount of time of 20 seconds. So I always tell people is, when you leave class today and next time you go to the bathroom or wash your hands before you're going to eat dinner, I challenge you to actually time yourself on this. Be sure that you're scrubbing all areas of your hands with soap and water. So, what areas am I talking about? So I say don't forget your nails. Under your nails, around your nails, the backs of your hands, between your fingers. If soap and water are not available, you should use some type of alcohol-based hand sanitizer. However, if that was your choice and that was your only option, you should wash your hands as soon as you do have access to soap and water. Cleaning and disinfecting. Reusable equipment as well as surfaces that have been contaminated do need to be disinfected after the incident. These areas should be cleaned as soon as possible, but never compromise the care of someone by stopping and cleaning up after a situation. So wait until either EMS has taken over for you before you clean up the area. But it's really important to clean these areas because you don't want anyone further becoming contaminated by any of these objects. Yes, there are steps to cleaning and disinfecting an area. Step one is, first of all, if there are anything broken glass or sharp objects, these should be picked up first. And they should be picked up with either tongs or a disposable dustpan and broom because you don't want to cut yourself when you do begin to clean up the area. Next, you're going to wipe the area with some type of absorbable material, so a towel or paper towel. Next, you're going to, what we refer to as flooding, so just completely saturate the area with a disinfectant. A disinfectant can be something that's some store-bought solution, but you do want to make sure that store-bought solution will kill a variety of different types of bacteria and pathogens. Or you can simply make a solution of 1 part bleach to 10 parts water. The solution should sit on the area for a minimum of 10 minutes to allow it to properly disinfect the area. Next, you want to dispose of these materials in a labeled biohazard container. Everyone looks at me and they're like, well, I don't know where a biohazard container is in my workplace. Okay, if a biohazard container is not available, it's okay to put them in some type of sealable container or even a bag that you label as biohazard. But you should never just throw biohazard in a trash can. Why? Because there is someone after you that has to take care of that trash. And if they don't know that there's biohazard in that trash, they might become in direct contact with that biohazard. Some places you can dispose of your biohazard containers are local hospital, doctor's offices, fire and ambulance stations, as well as you could give it to EMS when they arrive and they can take it from the scene for you. You might have to fill out an exposure incident. So if another person's blood or other bodily fluids comes in contact with your eyes, mouth, nose, or a break in your skin, or you experience some type of needle stick or cut from a contaminated object, you will need to fill out an exposure incident. You need to immediately, if you do come in contact with something, decontaminate the area by washing it, flushing it, or splashing it with soap and water when appropriate for at least 15 to 20 minutes. Report the incident to EMS personnel, your employer, or a healthcare provider. And depending on protocol, you may need to follow some other steps. So, for example, your workplace may, if this happens at your job, there is going to be a strict, specific protocol that you are going to follow. However, if you're just helping someone on the street and you come in contact with something, the best thing you can do is tell EMS, as well as visiting either a hospital or your primary care physician to be checked out. So next is taking action, okay? So we've talked about your 4 roles in an emergency. So now it's time to take action. American Red Cross uses 3 steps to guide your actions, and those steps are check, call, care. Make sure that you know them and know their order. Check is simply checking for the scene for safety, as well as checking the person. Next is call, which is calling and activating EMS or by calling 911 or another designated number. And care, as we mentioned before, is care for the person as you are trained until further help arrives. So to talk about check a little more. First, you always check the scene. Once you determine the scene is safe, you can enter the scene. So checking the scene includes, is the scene safe for you to enter? Also, can you tell by checking the scene maybe what happened? So remember to use your senses to identify if an emergency exists. So what can you tell from your sight, sound, smell, or gut instinct of what happened? How many people are involved? Are there multiple injured people? Is there just one person? Is there anyone else around that can help you? Also, maybe what's your initial impression of what's going on? Next, you're going to check the person. If the person is awake or what we call responsive, you should always obtain consent. So don't forget to ask for consent before you actually put your hands on them to help. However, the person is unresponsive. You're going to shout at the person using their name if you know it. If you don't, you can just shout at them. For example, you can shout, "Are you okay? Are you okay?" If they don't respond, you can tap on their shoulder. In the case of an infant, you should tickle the bottom of the foot to see if you get any type of wiggling of the toes or reaction that way. Check for breathing for no longer than 10 seconds. The picture at the bottom of the screen is demonstrating how to check for breathing. All of these things should occur in less than 10 seconds. Make sure you understand that. Unresponsiveness is coined as anything that, unresponsiveness, trouble breathing, or severe bleeding are all considered life-threatening emergencies. If after this initial check, the simple check right here, you reveal any life-threatening emergencies, you should go ahead and call 911 and have someone, that should not say brain, you should have someone bring an AED and a first aid kit. We're going to discuss in Chapter 2 even more detail on checking and evaluating a person. The next step, like I mentioned, is call. So if you determine that it's necessary to call, you're going to quickly place that call to 911 or the designated number, or whenever possible, have someone else do this. Remember, in some situations, you're going to be the highest trained person there, and you're going to be the person taking charge. So you might need to tell other people to do things like calling 911. Be prepared to answer questions when you are on the phone. Like, for example, they're going to ask you where you are. What's the nature of the incident? The phone number that you can be reached back at if you become disconnected. A description of maybe what happened, the number of people involved, and what help, if any, has been given. You should always stay on the line with the dispatcher until they tell you or ask you if it's okay to end the call. Remember, dispatchers are great. They can give you guided information as to what you should do in an emergency situation should you forget everything that I've taught you in this class. If you're alone and there's no one else to call 911, you might have to decide to call first or care first. So call first situations are likely cardiac arrest. In cardiac arrest emergencies, it's always important to get further help to the scene as quick as possible. Care first situations include breathing emergencies and severe bleeding. In these situations, you can take immediate actions to prevent the person's condition from worsening. Once the situation is a bit under control, then you can call. However, I will add there that you should provide about 2 minutes of care in your care first situations before calling. Box 1-8 will give you a list of all of your care first or call first situations. Note that you should only care first if you are alone and you don't have an immediate way to call. Okay, we live in the world of cell phones. If you can care and call at the same time, for example, you can call 911 and put them on speakerphone, or maybe you're on your headset of your phone already. I had a perfect example. I was in an airport this summer, and I was talking on the phone and using my headset, and someone collapsed right in front of me. So I ran over, and I didn't need to personally call 911, but my mom got a great description of what was going on in the emergency the whole time, because my headphones remained in my ears and my phone was in my pocket, and she got to listen in. So that's an easy way to free up your hands and care for the situation. So really, in your care for situations, it's when you are alone and there is no way to simultaneously call and care at the same time. And then we have our care. So check, call, care. That this is the final action. And really your first two, check and call, are going to be fairly quick. You should provide the care for the conditions that you find, and only at the level you are trained at. Remember, don't take anything that you learned on Grey's Anatomy, but only those things that you have been trained and taught in this class. In general, you need to follow some guidelines when providing care. You never want to hurt the person any further. Make sure you're monitoring the person's breathing and level of consciousness when you're providing care. These things can change. The person can at first be conscious and then lose consciousness on you. If appropriate, you can have the person rest comfortably. If they're in a standing position, you could have them sit down, you could have them lay down. Keep the person from getting chilled or overheated. Also, you want to make sure that you're reassuring the person. With this being said, don't be obnoxious. Don't constantly ask, are you okay? Are you okay? You're going to be all right. The better thing to do is just remain really calm. Keep a nice, calm tone to your voice. And just remind them that, EMS is on their way. There's going to be more help here for you soon. Everything is going to be okay. Give the care that you're trained to do, like I mentioned before, and then monitor the person for any changes in their condition. In general, you want to make sure that you avoid moving a person to provide care. Unnecessary movement can at times cause further harm, pain, or complicate the situation. Under 3 conditions, it is appropriate to move the person. The person must move the person to save them from immediate dangers. But note, you should never enter a dangerous situation. You must move them to reach a more seriously injured person. You must move the person to provide appropriate care. For example, you may need to roll the person if they are face down. You might need to roll them onto their back. Or we'll talk about it with CPR. If someone's in a bed and they're in cardiac arrest, a bed is not an appropriate place to provide CPR. You're going to have to move them onto a firm surface like the ground. You can refer to Appendix A on ways to move people, and we will talk about in class different ways you can move someone if absolutely necessary. If a person does not have a life-threatening emergency, you or someone else may decide to transport the person to an emergency facility if needed. However, I really don't encourage this unless it is someone you know, so maybe a family member, or one day maybe it's a child of yours. But never transport a person if their condition could worsen on you and become life-threatening. It's always better to call and have them transport in those situations because they have more medical equipment on the ambulances to care for situations. And I always say to always discourage an ill or injured person from transporting themselves, okay? Driving can be dangerous when you're in pain or you're limited due to an injury. And sometimes the condition could worsen while driving and create a very unsafe driving situation. We don't need an injured person driving a car, getting an accident, and then causing more injured people. All right, so that about sums up Chapter 1, Before Giving Care. You will find a list of review questions. We are not going to talk about them on the visual or audio portion of this lecture. But what I encourage you to do, because these are going to be really helpful for taking your quizzes and questions I'm going to bring up in class and being prepared to in class to talk about some things, as well as the American Red Cross exam. So please review all of these review questions, utilize the PowerPoint, utilize the book, or challenge yourself and see how many of these you can answer without using those supplemental materials. Hope you enjoyed the first chapter, Chapter 1, Before Giving Care. I'll see you in class soon.